Hey, I'm Adam Bruggeman, Chair of the Council of Advocacy, and my pleasure to have Dr. Kevin Bozic, immediate past president of the Academy, with me. Uh,
Happy to be here. Thanks for having me.
yeah, wanted to ask you a little bit about value-based care. So let's talk a little bit about the future of healthcare. Why is value-based care important, and what is the Academy doing to help make sure that we're on the forefront of it?
I think it's a great question. I think the first thing that when I get asked that question, I have to remind people of how we define value in healthcare because I think it's misunderstood in many cases. And when we talk about value in health, we talk about the health outcomes that matter to patients that are achieved per dollar spent to achieve those outcomes. And what you realize when you see that is in order to improve value, you have to improve health. So value-based healthcare means that we're focusing on the health outcomes as opposed to other metrics like quality and safety and other things. And I think when you put your focus on health and health outcomes, everything else falls into line underneath that. And it has a number of advantages. Number one, it aligns the incentives of the clinicians with those of their patients, which the secondary advantage, which I've only learned in the past few years, is it leads to joy in practice and reduces moral injury, which is something that I didn't fully understand before. But because of that, if you look at the groups that are fully immersed in value-based models like ours, the turnover is extremely low and the retention is extremely high because people are fully aligned with what they went into medicine and orthopedics to do.
Yeah. One other kind of different question. You've made it all the way through the presidential line. You become president of the Academy. Some of our residents are here. Some of our younger members of the Academy are here. How does somebody get involved in organized medicine, whether at the state or federal level? What are your recommendations?
So I think that there's lots of different ways to do that, and you're a good example. There are state orthopedic societies, there's the AMA, there are specialty societies, and there's the AAOS. And I have held roles in all of those, and I think they serve different purposes. I think probably one of the most underlooked aspects of organized medicine is the opportunity for leadership development. I am the leader I am today, and I've had the impact I have in my day job because of the roles that I've had in organized medicine. And I think that it's great to see so many residents here at the Texas Orthopaedic Association meeting. These are our future leaders, and I think getting involved at the coming to meetings and getting involved in committees early on. There are a number of opportunities to be on resident committees. In the AAOS, there are resident slots on other committees. And I think that it's poorly understood how many opportunities there are. I think it's also really important to identify a mentor, somebody like Adam, who's had leadership roles, who can help navigate the process, because it can seem very overwhelming for somebody early in their training or in their career.
Well, thanks for having us out here. Welcome from San Antonio at the Texas Orthopaedic Association meeting. Look forward to having everyone join us next year.
Hook 'em.